Heart Attack Emergency and CPR Introduction and the Human Heart System Narrator. Every day, inside your chest, a miracle is happening. Your heart is beating 100,000 times each day without you even thinking about it. This rhythm is the foundation of life. It pushes oxygen and nutrients to every part of your body. Without it, no organ can survive. Without it, you cannot live even a few minutes. The heart is an extraordinary pump, about the size of a fist, yet powerful enough to pump blood through more than 60,000 miles of blood vessels. These vessels reach every cell. Every second, your brain, your muscles, your skin, all are fed by this endless river of life. The heart is divided into 4 chambers, 2 atria and 2 ventricles. The right atrium receives blood without oxygen. The right ventricle sends it to the lungs. In the lungs, the blood collects oxygen. Then the left atrium receives this oxygen-rich blood. The left ventricle pumps it powerfully into the aorta and from there to the entire body. This cycle never stops. By the age of 70, your heart will have beaten more than 2.5 billion times. No machine on earth can match this endurance, but this miracle is fragile. If the blood supply is blocked, or if the electrical system fails, the rhythm can stop. When that happens, life itself is at risk. What is a heart attack? A heart attack, medically called myocardial infarction, happens when blood flow to part of the heart muscle is blocked. Most often, this is because of a clot in the coronary arteries. These arteries feed the heart muscle itself. If they are blocked, the muscle starves of oxygen. Imagine a highway full of cars. If there is a crash and the road is blocked, traffic stops. In the same way, if a coronary artery is blocked, blood cannot pass. The cells beyond the blockage begin to die. Symptoms can include chest pain, pressure, pain radiating to the left arm, neck, or jaw, sweating, nausea, and shortness of breath. But remember, not all heart attacks show obvious symptoms. Some are silent, especially in women and in diabetic patients. What is cardiac arrest? A heart attack is a blood flow problem. Cardiac arrest is different. It is an electrical problem. In cardiac arrest, the heart's electrical system suddenly malfunctions. The normal rhythm is lost. Sometimes the heart quivers in a useless motion called ventricular fibrillation. Sometimes it flatlines completely. In either case, blood stops flowing. The person will suddenly collapse. They will not respond. They will not breathe normally. There will be no pulse. Without immediate CPR, death occurs within minutes. Why time matters? Time is the most important factor. Brain damage begins within 4 minutes after the heart stops. By 10 minutes without CPR, survival is almost impossible. This is why CPR is vital. Each push on the chest manually pumps blood to the brain and heart. Each second delays death. Each second gives a chance. Imagine standing in a room where someone collapses. You call for help. If you know CPR, you do not have to wait helplessly. You become the bridge between life and death. Your hands become the heartbeat until help arrives. In this first part, we have explored the miracle of the human heart, the tragedy of blockage, the chaos of cardiac arrest, and the importance of every second. In the next part, we will move from knowledge to action. We will learn how to respond in an emergency, how to prepare, and how to take the first steps in CPR. Remember this. Knowledge is power, but only if you act on it. You can be the difference. You can save a life. Heart Attack Emergency and CPR Part 2. Emergency Response and CPR. Preparation. Narrator. When a medical emergency happens, every second is critical. In this part, we will learn what to do when someone suddenly collapses. Your actions can mean the difference between life and death. Recognizing an emergency. Imagine you are walking in a park or sitting at home with family. Suddenly, someone clutches their chest and falls. Do not ignore. Do not hesitate. Act immediately. First, check if the scene is safe for you. You cannot help if you become a victim yourself. Once the scene is safe, approach the person. Tap their shoulder and shout loudly, "Are you okay?" If there is no response, immediately move to the next step. Checking breathing. Look closely. Is the chest rising and falling? Listen for breath. Feel for air near the nose or mouth. If the person is not breathing or only gasping abnormally, this is cardiac arrest. You must act now. Calling for help. Always call emergency services. In many countries, the number is 911. In others, it may be 112, 999, or a local number. If you are not alone, send someone to call immediately. If you are alone, call first before beginning CPR. If an AED automated external defibrillator is available nearby, ask someone to bring it at once. Preparing for CPR. Now, position the victim. Lay them flat on their back on a firm surface. Kneel beside their chest. Place the heel of your hand on the center of the chest, between the nipples. Place your other hand on top. Lock your elbows. Keep your shoulders directly above your hands. This position gives maximum strength. The rhythm of life: push hard and push fast. Compress the chest at least 2 inches deep at a rate of 100 to 120 compressions per minute. That is almost 2 pushes every second. The beat of the song, "Stay In Alive," matches the correct rhythm. Keep the pace steady. Do not stop. Allow the chest to fully rise between compressions. This lets the heart refill with blood before the next push, staying calm under pressure. In an emergency, fear is natural. Your hands may shake. Your mind may panic. But remember, doing something is better than nothing. Even imperfect CPR is better than standing still. Take a deep breath. Focus on your hands. Count aloud as you push. 1, 2, 3. This keeps rhythm steady and calms your nerves. Transition to next part. You now know how to respond, how to call for help, and how to prepare for CPR. In the next part, we will dive deeper into the technique itself. Hands-only CPR and the use of an AED can double or even triple survival chances. Knowledge is power. Action is life. Heart attack emergency and CPR, hands-only CPR and AEDUSE narrator. You have recognized cardiac arrest. You have called for help. Now it is time to take direct action. In this part, we will learn about hands-only CPR and the use of an AED hands-only CPR. Hands-only CPR means giving chest compressions without rescue breaths. Research shows it is highly effective, especially for adults who collapse suddenly. It is simple, easy to remember, and anyone can do it. Position yourself correctly. Place the heel of your hand in the center of the chest. Put your other hand on top. Keep arms straight, shoulders above your hands. Push hard and push fast. 100 to 120 compressions per minute. Each push should be at least 2 inches deep. Do not be afraid of breaking ribs. A broken rib can heal. A stopped heart cannot. Allow the chest to rise fully after each compression. This is vital. Without full release, the heart does not refill. With blood and compressions lose power. Do not stop until help arrives or until an AED is ready or until the person shows signs of life. Adding rescue breaths. In some cases, especially with children, infants, or drowning victims, adding breaths is recommended. After 30, compressions, tilt the head back, lift the chin, and give 2 breaths. Each breath should make the chest rise. Then return to compressions. But remember, if you are untrained or uncomfortable, hands-only CPR is always better than doing nothing. AED, the shock of life. AED stands for Automated External Defibrillator. It is a small device that delivers an electric shock to restart the heart's rhythm. These devices are found in airports, malls, offices, and public places. When an AED arrives, turn it on. The device will speak to you with clear instructions. Expose the chest. Attach the pads as shown in the pictures. 1 pad on the upper right chest, the other on the lower left side. Stand clear when the device analyzes the heart rhythm. If a shock is advised, the AED will tell you. Press the button. Make sure no one is touching the victim when the shock is delivered. After the shock, immediately resume CPR. Do not delay. Continue until the person recovers or professional help takes over. Why AED is crucial. In cardiac arrest caused by ventricular fibrillation, CPR alone cannot restart the heart. Only a defibrillator can. Every minute without defibrillation lowers survival by 10%. With both CPR and AED, survival chances can double or triple. Transition to next part. You now understand hands-only CPR and how to use an AED. In the next part, we will explore advanced care steps, recovery position, and what happens when emergency professionals arrive. Knowledge grows. Advanced care and recovery position, narrator. In the previous parts, we learned to recognize cardiac arrest, perform CPR, and use an AED. But what happens next? What should you do if the person starts to breathe again, or if professional help is on the way? This part explains advanced care and the recovery position, signs of life returning. While performing CPR, always watch for signs of life. The person may begin to move, cough, or breathe normally again. If this happens, stop compressions, but do not leave them alone. Their condition can change quickly. The recovery position. If the person is breathing but unconscious, place them in the recovery position. This keeps their airway open and prevents choking. Step 1. Kneel beside the victim. Make sure both legs are straight. Step 2. Place the arm nearest to you at a right angle to the body. Bend the elbow, palm facing upward. Step 3. Bring the far arm across the chest, placing the back of the hand against the cheek nearest you. Hold it there. Step 4. With your other hand, lift the far leg just above the knee and pull it up so the foot is flat on the ground. Step 5. Carefully roll the person toward you onto their side. Step 6. Tilt the head back slightly to keep the airway open. Make sure the mouth is angled downward to allow fluids to drain. Check breathing regularly. If they stop breathing again, roll them onto their back and resume CPR immediately. Why the recovery position is important. An unconscious person can easily choke if their tongue falls back or if they vomit. The recovery position uses gravity to keep the airway clear. It is a simple technique that can save lives. Advanced care, what professionals do. When emergency medical professionals arrive, they bring advanced tools. They may provide oxygen to support breathing, intravenous medications to restart or stabilize the heart, advanced airway management to ensure proper ventilation, hospital transport for further treatment such as angioplasty, stents, or surgery. Your role is critical until they arrive. Without your CPR and quick actions, advanced care might be too late. Staying with the victim. Never leave the person alone until trained help takes over. Reassure them if they are conscious. Stay calm, speak gently, and monitor their breathing and pulse. Your presence is important as your actions. Part 5. Prevention and Awareness Narrator. We have reached the final part of our journey. We have seen the miracle of the human heart, the tragedy of cardiac arrest, the power of CPR, and the importance of professional care. Now we must look forward. Prevention and awareness are the keys to protecting lives before emergencies happen. Understanding risk factors. Heart disease does not appear overnight. It builds silently over years. The major risk factors include high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, unhealthy diet, stress, and lack of sleep. Some risks cannot be changed, such as age or family history, but many risks are within your control. Lifestyle changes. Small changes make a big difference. Quit smoking. Within 1 year, the risk of heart disease drops sharply. Eat more fruits, vegetables, and whole grains. Avoid processed foods and excess salt. Exercise at least 30 minutes a day, 5 days a week. Walking, cycling, or swimming keeps the heart strong. Maintain a healthy weight. Even a 5% weight loss can lower risk. Control blood pressure and blood sugar with regular checkups. Reduce stress with meditation, prayer, or relaxation techniques. knowing the warning signs. Awareness saves lives. Chest pain, shortness of breath, sudden dizziness, or unexplained fatigue should never be ignored. Seek medical help immediately. Early action prevents tragedy. Community awareness. Communities can prepare together. Schools, offices, and organizations should teach CPR and place AEDs in public spaces. Every trained person increases survival chances. Awareness campaigns spread the message that anyone, anywhere, can save a life. The power of CPR training. If you have not yet taken a CPR course, make it a priority. Training gives confidence. Practice makes the technique natural. One day you may be the only one standing between a loved one and death. Knowledge is power. Action is life. Final message. The heart is more than a muscle. It is the rhythm of life, the center of our emotions and the engine of our body. Protect it with healthy choices. Respond with courage in emergencies. Share knowledge with others. This concludes our 5-part journey. You now carry the tools to understand, to act, and to save lives. The power is in your hands. Be ready. Be aware. Be the reason someone survived.